Vice Admiral Bordado, friends from the Center for Naval Leadership and Excellence, ladies and gentlemen of the Philippine Navy, fellow Filipinos, may this day find you and your families well despite these difficult times. I am grateful for the opportunity to share our research and policy insights as part of the Navy's governance series. It is my second opportunity to speak in this series, and I am deeply honored and humbled by this second opportunity. I have the austere task of providing some insights on our nation's challenges against the twin crises we face today: a still surging pandemic risk and a severely weakened economy. While I speak about the health system and our economy, I would like to emphasize the importance of our third and possibly bigger challenge, that of wanting leadership and governance. Some of the first reported COVID-19 cases in December 2019 were in China, and this virus has since spread across over 200 countries, territories, and areas in less than 4 months. Today, early September 2021, COVID-19 is associated with almost 220 million cases worldwide and over 40.5 million deaths. In the Philippines, from when the first COVID-19 case was confirmed as of January 30, 2020, and the first case was a 38-year-old Chinese national, COVID-19 cases have increased and continues to push our health system and our economy to the brink. At the time of this lecture, almost 2 years later, the Philippines has registered over 2 million cases and well over 30,000 deaths. I will now proceed to my presentation. The first image I want to show you probably best summarizes the challenges that COVID-19 has produced for our country. And this basically shows the number of COVID-19 cases since the first few cases were reported in early March 2020 until this lecture, which is around early September 2021. And you can see here that there are 4 times that our country has had to implement hard lockdown. I say hard lockdown because during the entire period, there have been many mobility restrictions. So in reality, meron din po talaga tayong lockdown at mobility restrictions all throughout the period since the first cases were identified. Pero yung totoong hard lockdown, yung talagang masusing mobility restrictions, nag-umpisa noong March 2020. And since then, there have been 4 cases of hard lockdown in the Philippines. The challenge actually is that we have been forced to hard lockdown 4 times, and yet we did not seem to be able to build a stronger health system and a stronger containment strategy for keeping down the potential surge in COVID-19 cases. So kahit na nag-lockdown tayo at ang main purpose ng lockdown ay to buy us time, binibigyan tayo ng oras para palakasin yung mga sistema natin para pagka humaharap ulit tayo ng surge risk, hindi na natin kailangang mag-hard lockdown. Yun po yung logic ng hard lockdown. At hindi po natin pwedeng isipin na hard lockdown is going to be our response every time we have a potential risk in COVID. Why? Because the way that it will affect our economy is if we keep on implementing hard lockdown, most likely the economy will fold. Most likely the economy will really collapse. So makikita po natin dito, 4 times nag-hard lockdown ng Philippines. And we have always had to resort to hard lockdown every time there was a big threat of a surge. Other countries have been able to keep many parts of their economy open because of more efficient containment strategies. Hindi nila kinailangang mag-hard lockdown ng kasing dami ng beses ng atin. At dadagdag ko pa dito na kahit na hindi tayo naka-hard lockdown, marami pa ring mobility restrictions. So the way that it is reported in media, in international media, is we have been in the longest lockdown throughout the period of the pandemic. While other countries have been able to open up their economies and loosen their mobility restrictions much more than we have because they were able to contain the risk of surge. So what has been the effect? Well, basically, we have had 5 straight quarters of negative growth. And this was only broken in the second quarter of this year by a positive growth registered in the second quarter of 2021. And that's actually good news, except the issue with that is that in the previous year, we have had a very, very big contraction in the economy. So sinasabi po ng mga economista dyan, may base effects. Kung maliit yung economy, nag-shrink siya ng malaki, mas madaling mag-register ng growth the next year. So that is where the 11.8% comes from. So we are now expecting further challenges moving forward because we have had to implement another lockdown in basically the third quarter of this year. And until now, we still have strong mobility restrictions. So this is a big concern for the economy because most likely the third and fourth quarter, we will be facing headwinds in terms of economic growth. So this is just an image of the GDP per capita of the country in real terms, registered from 2000 until 2021. At makikita po natin dito na yung real GDP per capita ng bansa, paakyat po yan yung trend, no? Paakyat yung pattern ng real GDP per capita. Except dito, during the pandemic, bumagsak po yung real GDP per capita natin. At yan yung kailangan nating bawiin. So as far as the last real GDP per capita figure is concerned, it seems that the level of the real GDP per capita is close now to around the 2017-2018 level. So natanggal yung gains natin since around 2017-2018 at kailangan po nating bawiin yan para bumalik tayo dun sa long run trend na paakyat yung ating real GDP per capita. Kung matatandaan niyo po, yung real GDP per capita is the measure of our output or income in the economy. So pagka lumalaki po yan, nag-i-increase yung ating wealth, yung ating kakayahang bumili ng mga bagay. At kung nagko-contract yan, obviously, nagdi-decrease yung ating income, nagdi-decrease yung ating output bilang isang bansa. So this is, again, the point that I raised earlier. The Philippines has made a sort of a distinction, not in a positive sense, but in a negative sense, that we have been one of the countries, if not the country in the world, implementing the most stringent and longest lockdown during the pandemic period. Now, ang issue po dito again is you can interpret this as we have paid the highest economic price to contain surges in COVID-19. So when we were analyzed by the World Bank and other analysts out there, they have noted that the Philippines has been less successful in the Asian region in transitioning away from shutdowns to a more efficient containment strategy. The tough response has imposed a big cost on the economy without delivering a commensurate benefit. So because natutulak tayo palagi sa hard lockdown, hindi makayanan ng sistema natin na makontain yung surge, malaking-malaki yung cost natin to actually contain COVID-19. So this goes to the topic of today's discussion, which is what is the importance of governance and leadership in our public sector. And obviously, governance and leadership plays a key role in setting up that system for containment, in setting up our pandemic management response. Now, I just want to note a few more figures here. In the last hard lockdown that we implemented, which was around early August of 2021, the estimate of NEDA for the 2 weeks that we were on hard lockdown, at least NCR, is that we lost 210 billion pesos. Around 167,000 workers faced job losses and income cuts. I think this is actually an underestimate. Palagay ko, mas marami pang malamang na natanggalan ng trabaho. Bakit? Kasi pang-apat na beses na nating mag-hard lockdown. Kung iisipin nyo lang po, kung ikaw ay isang business person at nakikita mo na every time may surge, kailangan mag-hard lockdown at during the hard lockdown, wala namang kinikita yung business mo pero nagpapasweldo ka pa rin ng mga tao, marami sigurong business na natulak na magsara. At yan ang problema. Pagka paulit-ulit yung ating insistence, reliance on hard lockdown as a last resort. Ideally, which is what the other countries are doing, you are referring to or you are resorting to a containment strategy that does not require a hard lockdown. At yun yung tinatawag na test, trace, and treat and containment and quarantine. So kung nahuhuli nyo kagad yung pagkalat ng COVID-19 cases at napapababa mo yung number of cases, hindi mo na kailangan mag-hard lockdown ng buong ekonomiya. So yan ang pagkukulang natin dito sa ating pandemic response. And this is also why I insist on calling this pandemic mismanagement. Kasi kung nawawalan ng trabaho, nagugutom ang ating kababayan, hindi ito dahil lang sa pandemya. Hindi yan dapat ibe-blame lang natin dahil merong disease out there called COVID-19. Bakit yung ibang bansa hindi naman nawalan ng ganong karaming trabaho? Bakit yung ibang bansa hindi naman nagkaroon ng ganong karaming gutom na mga tao? Kasi maayos yung kanilang pandemic response. So hindi dapat i-blame sa pandemya lahat ng nangyayari ngayon. In fact, many of us are convinced that we could be doing a much better job than what we are doing right now, especially if we look at other countries that are doing far, far better than the Philippines. So here are some further negative developments. So Fitch, one of our credit rating agencies that has been monitoring the economic impact of COVID-19 on our economy, has now revised downwards the outlook for the Philippines to negative. So ito yung pinaghirapan natin in the last decade. We are trying to improve our credit ratings so that the cost of access to credit, access to liquidity in international markets for both our private sector and for our public sector, hindi sana siya ganun kalaki yung cost kung malakas yung credit rating natin. Pero ngayon, mukhang bumababa na ito dahil yung ekonomiya natin ay humihina. At nakikita natin yan dahil yung forecast ng ating economic growth ay bumababa din. Kasi nga, palagi tayong napupush back into hard lockdown. At pag napupush back tayo into hard lockdown to contain COVID-19 surges such as the new variants that might be threatening our country, sumasara at humihina yung ating ekonomiya. The other issue is we seem to be throwing a lot of money onto the problem, and yet yung pera hindi naman klaro kung paano ginasta, kung mahusay yung governance nung paggasta ng pera na yan. At yan na nga yung talakayan ngayon sa Senado na pinag-uusapan nila, sinisiyasat nila kung paano ginasta yung pera. So there are clear governance issues as well in terms of our public finance. And because we have been borrowing heavily in order to finance our COVID-19 response, in addition, the growth rate of the country has been weakening. The country's debt to GDP ratio, yung ratio po nung utang natin on top of our total GDP, yung total output natin, ay bumababa at ay umaakyat, right? Because umuutang tayo ng mas malaki. So yung debt to GDP ratio natin jumped to a 16-year high. At kung titingnan natin yung debt to GDP ratio, eto siya ngayon, close to 54%. Now this is something the economists are monitoring because if it reaches anywhere near 60%, that is usually a warning sign in terms of weaker macroeconomic fundamentals for the country. So the last time we were on 54% or anywhere near 60% was around 2005-2006, itong mga period na to. And definitely during that period, our credit ratings were not that healthy. At in fact, mas mataas pa nga yung pinanggalingan natin. At sana naman hindi na natin babalikan yung mga panahon na yun, na kung saan yung credit rating natin ay napakahina, and therefore if we need to finance our infrastructure, finance our investments, in fact even finance our modernization of our public sector and maybe even our AFP, mas malaki yung gastos kasi yung credit rating ay mahina at yung interest na i-charge nila ay mataas. So again, more bad news. Actually, Nomura, which is another big bank and analyst group that is monitoring economies in Asia, has reported the Philippines as one of 10 troubled emerging markets. And the main challenge is debt problems, capital flight, and large fiscal and current account deficits. How is this relevant to the armed forces of the Philippines and to the Philippine Navy? Pagka hindi malakas yung ating economy at hindi rin malakas yung ating tax revenues kasi nga mahina yung ekonomiya, merong risk na hindi natin matuloy yung modernization ng ating armed forces. At yung modernization ng ating armed forces ay nakasalalay sa lakas ng ating ekonomiya. You can also think of the different countries in the region that way. Kung malakas yung economy ng Malaysia, malakas yung economy ng China, malakas yung economy ng Indonesia, they can afford all of the modernization that they are needing as a country. For us, the Philippines, our economy was actually very well managed and very well run until recently, at least until the challenges of the pandemic that we are facing today. And because of the pandemic mismanagement, humina yung ating ekonomiya at humihina na rin yung kakayahan natin na gumasta at mag-invest. And definitely that will pose risks on our modernization plans. And here, finally, a bank and a group monitoring our credit rating has also now signaled that there is an imminent risk of a Philippine credit downgrade, which is, again, what we have been talking about earlier. Now, I just want to spend some time explaining why are we forced into on-again, off-again lockdowns? And why is this linked to governance and leadership in the country? Papakita ko lang po yung ilang mga areas para maintindihan natin kung bakit hindi natin makontain yung surge at bakit palagi tayong nag-shift to hard lockdown. First question is vaccination timely and progressing? Vaccination is very, very important because while we don't know everything in terms of dealing with COVID-19 and definitely the new variants that may be threatening the world, what we do know is that many of the vaccines are helpful, and if we are able to vaccinate our population in a very inclusive and rapid way, then we are protecting our population and maybe increasing the chances of opening up our economy sooner rather than later. Pero kung titingnan po natin dito, yung vaccination rate, ibig sabihin yung share of the total target population that needs to be vaccinated. Usually, yung target population for the theoretical target of herd immunity is around 70%. Pero dito makikita natin yung Philippines, nandun pa lang tayo sa 17%. Malayong malayo to 70% and therefore malayong malayo pa rin dun sa total target population being vaccinated. What is the reason for this? We rolled out our vaccination program fairly late compared to the other countries. There were countries that were actually rolling out programs as early as December 2020 and January 2021. Ours started rolling out much, much later. Nag-roll out ng few vaccinations in March, pero kulang pa rin yung vaccines then. At nagdagsaan na yung vaccines much, much later, several months later. In fact, today, the issue is still that we don't yet have enough vaccines to reach the 70% of the population. But hopefully, we are expecting most of these vaccines to arrive soon. The challenge, however, is that they are arriving quite late. At maraming ibang bansa, nakuha na nila yung vaccines nila and therefore, makikita nyo na ang taas na nung vaccination rate nila. The other challenge, of course, for the Philippines is we have vaccine hesitancy risks in the country. Ano ang ibig sabihin ng vaccine hesitancy risk? Ayaw magpabakuna ng ating mga kababayan dahil natatakot sila, nababagabag sila sa vaccine at yung potential effect sa kanila. Ang issue po dito, at malamang alam niyo po ito, nagkaroon ng malaking issue ang isang vaccine before na tinatawag na Dengvaxia. At kahit na pinagkakatiwalaan na ang Dengvaxia ng iba-ibang bansa sa mundo, ginagamit na to sa iba-ibang bansa, dito sa Pilipinas, it was being demonized in a very politicized way. And the impact of this criticism of the vaccine program, Deng Vaxia, may have actually impacted vaccine programs in general. So marami pong mga nanay na nabagabag sa pagba-vaccinate ng kanilang mga anak at meron po mga pag-aaral nito. Nagsa-survey po tayo para makita kung ano yung tingin ng ating mga kababayan sa vaccination program. Hindi pa po ito link sa COVID-19, vaccination programs in general. And many of these research, some of which were even prior to COVID-19, showed that many of our people started to distrust vaccines because of the way that vaccine, Deng Vaxia, was demonized in a very politicized way. So we have to overcome the lack of trust, and we have to overcome this vaccine hesitancy. And here you will see that many Filipinos are still vaccine hesitant, at least according to these early surveys. In a May 2021 survey of SWS, only 32% of Filipinos were willing to get vaccinated. The rest were actually on the fence or did not want to get vaccinated for various reasons. And definitely, kailangan mag-build ng trust. Kaya napakahalaga na sundin yung proper protocol in terms of introducing the vaccine. So kung matatandaan nyo po, nagkaroon ng issue yung isang vaccine dahil hindi pa siya na-approve at ginamit na siya ng ibang mga kawani ng gobyerno. Matatandaan nyo po, may isang general na nagsabi, we vaccinated ourselves last late 2020. At kahit na hindi pa approve siya ng ating FDA. So yung mga ganong klaseng issue po ay nakakabawas ng trust ng taong bayan sa mga sistema natin at sa mga vaccines na iro-roll out ng gobyerno. Kung nakikita nila na hindi naman science-based at protocol-based, hindi nasusundan yung mga protocols sa pag-approve ng mga vaccine. Hopefully, we are overcoming that sooner rather than later because many other approvals of vaccines are now coming out, and even international organizations are lending their credibility and trustworthiness onto certain vaccines. Dito rin po mayroong mga anti-vax doctors na kino-call out na ng mga kapwa-doktor nila. At sana mabawasan yung ganyang klaseng anti-vax messaging because it could also become a hindrance to our vaccination programs. The next question is the healthcare system strong and inclusive? So yung unang tanong, vaccination, nag-progress ba ito? Ang isa pang tanong in terms of a strong containment strategy is the healthcare system must be strong, must be inclusive, and must be able to absorb the possible surge in cases. Kung kayang i-absorb ng healthcare system yan, mababawasan natin yung mga kababayan natin na maaring mapiligro o mamatay dahil kaya namang i-absorb ng healthcare system. Kung hindi na kayang i-absorb ng healthcare system, they will need to implement triage protocols where some of the high risk may actually be foregone, hindi na matitreat properly at magfo-focus na lang dun sa mga kaya pang i-save. At yan ay napakalungkot, and obviously pagka ganyan na nangyari sa healthcare system natin, mas maraming mamamatay. So the question is the healthcare system strong and inclusive? Did we manage to strengthen it when we were under lockdown, so that the absorptive capability of the healthcare system would catch up with the potential risks that we are facing? And unfortunately, the question is probably, the answer is probably no, because you can even see from later reports that private hospital groups are now facing the threat of workers declaring mass resignation, hindi nabayaran yung kanilang extra pay na pinangako sa kanila. At maraming ang mga ospital ang nagbabawas pa nga ng mga tauhan kasi nagka-cut rin sila in terms of their revenues. In fact, the early reports from the pandemic is that health seeking in the general sense declined kasi takot ang mga tao magpunta sa ospital dahil merong COVID-19 doon na tinitreat. So the effect on many people is not to go to hospitals. They became scared of hospitals. At ang isa pang issue actually in terms of our healthcare system is takot ang ating kababayan hindi sa COVID-19 kundi dun sa gastos ng mga ospital. So kung ganyan ang mangyayari, hindi sila nagpupunta ng ospital, they remain in their homes, they remain in their communities, COVID-19 is undiagnosed, mas malakas yung probability na kakalat yung disease. Kasi meron na pala silang COVID-19, hindi pa sila nag-health sick, hindi pa sila pumupunta ng hospital para magpa-test. So yan din, kaya kailangan malakas yung sistema ng healthcare system natin at inclusive siya. Ibig sabihin affordable. Hindi nakakatakot na mag-health sick, right? So definitely, yan pa rin ang challenge ng ating healthcare system ngayon. Maliit lang naman yung nako-cover ng PhilHealth at yung PhilHealth mismo ay kulang din ng pondo. So I think it's fair enough to say that we still need to improve the inclusiveness of our healthcare system. Ito, papakita ko lang again, the misuse of COVID funds alleged as Filipino health workers protest. So these are some of the latest reports coming out in terms of the Senate hearings right now happening in early September. Nagkakaroon ngayon ng issue yung governance nung pera na nilaan natin para sa COVID response. At yan ang issue. Kaya nga sinabi ko kanina na meron tayong health pandemic, meron tayong economic crisis, pero ang mas malaking challenge ay yung leadership and governance challenge natin ngayon. Dahil yung response natin dun sa health at saka sa economic crisis, parang kulang, parang hindi well managed. The follow-up question here is, are social transfers sufficient? Ito yung tinatawag na ayuda nating mga Pilipino. Ang social transfers ay napakahalaga dahil yan ang social safety net ng bansa para sumunod ang taong bayan dun sa mga mobility restrictions at para na rin maprotektahan sila from bigger or equally important risks such as hunger and poverty. So iisipin mo, ang sinasabi natin sa ating mga kapwa kababayan na may COVID-19 or may COVID-19 risk ay manatili sa kanilang mga bahay, huwag silang lumabas, kundi may increase yung probability na makakahawa sila. Pero kailangan nila ng tulong kasi nawalan sila ng trabaho, wala silang income, nilagay mo nga sila doon sa kanilang mga bahay, kailangan nila ng suporta doon. Hindi naman lahat ng tao na ma-lockdown ay may kakayahang mag-work from home. Hindi naman lahat ng mga tao ay maraming savings o maraming income na kung saan pwede nilang kunin yung kanilang pangangailangan. So ang nangyayari dito, kung kulang din yung ayuda natin, we cannot also expect our people to stick to the mobility restrictions. And the mobility restrictions will also fail because of the lack of ayuda. So it is actually self-reinforcing in a way. At yan ang naging issue. Social transfers were not sufficient. In fact, this is a picture of one community in Cebu. Nag-post na sila dito in protest. If you cannot feed us, free us. The spread of COVID-19 is not our fault. Stop the discrimination. So they are feeling discriminated against dahil sila ay nila-lockdown doon sa community nila dahil may threat of COVID, pero hindi naman sila natutulungan. So ang response ng ating mga kababayan ay hindi makinig doon sa lockdown, hindi makinig sa mobility restriction. Dahil mamamatay sila sa gutom kung hindi naman sila tulungan doon at manatili lang sila sa bahay. So kailangan coherent yung policies. You are implementing mobility restrictions and lockdown, but at the same time, you are providing social safety nets, social transfers, and stronger social protection in order for them to comply with those mobility restrictions so that the overall health and human development outcomes are much stronger. So yan ang isang obserbasyon nung nagsona ang Pangulo nung mid-2021. 16 months of lockdown, according to one senator who noted this. 16 months of lockdown with only 2 months of ayuda from central government. So the local governments have been providing ayuda to the best of their capabilities, pero hindi naman lahat ng local government ay maraming pera. So yan ang naging challenge in terms of social transfers. The other part, finally, is contact tracing efficient? And here, just so as not to belabor the point, even the contact tracing czar has been lamenting that contact tracing is not improving in the Philippines. In fact, as early as March of 2021, the contact tracings are reported that it is in fact worsening. For every case that they are able to find, there's less and less people, less and less contacts actually traced. And what is the reason for this? Because the contact tracing system is not entirely integrated and provided in a common platform. So kung makikita nyo po, pagka pumapasok tayo ng mga mall, iba-iba pa yung contact tracing apps na ginagamit natin. Although I heard na may improvement naman lately, the ideal case kasi, ang ginawa ng ibang mga bansa is they would have a common app. It would be used by many, many citizens, and that app would produce high-frequency data that is very timely for a timely policy response. Kung yung data is delayed, kung yung data is butas-butas, then you cannot expect policymakers to execute, actually to government to execute policies well. Kasi hindi base sa timely data at hindi base sa high frequency information. So kayo rin po, kung meron kayong mission in terms of the work that you do for the armed forces, you need really good data and information. If you do not have that, then you are going in blind. This is the same case with pandemic response. If we want to be able to contain possible risk of surge in COVID-19, we need the detailed and disaggregated data so that you don't need to lock down the entire area. Alam mo lang kung saan yung mga parte na mataas yung risk. Yun lang ang kailangan mong i-focus. Pero dahil nga hindi natin nakuha yung mga data na yan, hindi natin nakalap yung information na yan, ang response natin is one size fits all, lockdown lahat. So this is one of the big challenges that we are still trying to overcome. And it is clearly a collective action and coordination challenge, as well as the challenge of making our response more data and evidence-based. The last question, I think this is the last question here in terms of the system and why we are actually still struggling with containment is COVID-19 testing adequate? So as you all know, we have had big debates on the extent to which we need to test. So while some groups are advocating for mass testing, which is what other countries are doing, bumaba na rin po kasi yung gastos ng bawat isang test. So kaya na nating ma-afford yung mas comprehensive testing system. Pero hindi pa rin po tayo nagma-mass testing. And if you look at the figures in terms of testing by country, in terms of or scaled by population, the Philippines is actually not hindi naman po tayo kulelat, no? We are not last place, but neither are we in first place. We're just in the middle. I think the key to note here is that if we are testing, the point of the test would be to be able to make our test, trace, treat, and containment strategy much more cost efficient and effective. And that is what we are still not able to do. So yan si Philippines. In fact, we are testing per million as of August 27, which was the latest information I could get. That is 165,244. That is definitely above the tests per million of a place like Thailand, which is 116,135. But definitely below, a place like Malaysia, which is 665,659. So the key here is, are we using that testing information effectively in order to inform our containment strategy? And the answer is most likely no. So I just want to emphasize here, what are the long-term risks for the country because of our continued struggle to contain COVID-19 and to resuscitate our economy. And the sad thing that we should note here is that most likely COVID-19 will impose deep human development costs on the country and exacerbate our inequality. And inequality is very, very important, especially for national security, as I will note in this section. So here, this was early on in May of 2020. At least one lawmaker noted the economy is losing 18 billion daily because of the lockdown. The most recent estimate is 2 weeks is 210 billion. So in fact, there are different estimates, but I believe that we are losing a lot at this point in terms of every time that we impose a lockdown. In the first round of lockdowns in July of 2020, it was reported 1/4 of businesses closed operations. So mga business na mismo ang nagsara. At pag nagsara sila, marami ring malilay off ng mga tao. So an estimated 10 million workers lost their jobs in early 2020. And it's not clear whether these jobs were actually recreated or whether they went back to work because many businesses remained closed. So kung pupunta kayo sa mga mall, makikita nyo maraming mga areas vacated na ng mga business. Hindi naman sila nag-open ulit. And because of that, many unemployed and many already poor people na tinamaan pa ng COVID-19, the number of hungry families spiked. Nag-increase ang mga gutom. So from a national security perspective, of course, that the more hungry people there are, the more discontented people there are, and that could pose security risks for our country. There is an early estimate in 2020 that at least 1.5 million Filipinos would slide back into poverty. Most likely, it's actually larger than this because this was estimate was in 2020, and we are still in lockdown in 2021. We still have mobility restrictions. So most likely, even more businesses are closing, more people are losing their jobs, and more likely, more Filipino families are falling into poverty and hunger. The other stark news is that many students are unable to thrive in this pandemic new normal where they need to go to class using online. Alam naman po natin na hindi lahat ng bata, hindi lahat ng pamilya ay may magandang internet connection. So kung ganyan po ang sistema, marami rin po mga bata na hindi makapasok and therefore they will just drop out. And there are studies that show that if a child drops out of school, the longer that child doesn't go back to school, the higher the probability that they will actually drop out forever. Hindi na po mag-aaral yung bata. So that is now a big, big concern. And in fact, there is a UNICEF report recently released. This was just in late August of this year, that showing that the Philippines is among only 5 countries in the world that is yet to reopen their schools and have had closed schools since 2020. So this is actually very, very bad news for us because we are a very young country. We have a very young population. So kung hindi makapasok sa eskwelahan ng mga bata, magkakaroon ng impact yan sa kanilang kakayahan to break free from poverty in the future if they were actually in poverty, and if they were in the lower middle income status, there is also a risk that they may slide into poverty because of the weaker education investment. So here again, the 5 countries that we are one of in terms of not having reopened schools is Bangladesh, Kuwait, Saudi Arabia, and Venezuela, and these are all not necessarily stellar countries in terms of human development and investments. But suffice to say that for us, it's a big challenge for us to lower the long-run costs of this crisis on our population. So I just want to show you this cartoon, which I think is evoking a very good message for us in terms of inequality, or a very strong message for us in terms of inequality. Ang sinabi po nitong cartoon na to, we are not all in the same boat. Kasi yung una, sinasabi ng mga tao, pare-pareho naman tayong tinamaan ng COVID-19. Hindi po. We are not all in the same boat. We are all in the same storm. Some of us are in super yachts. Nasa yate po yung iba. Ibig sabihin, kayang-kaya nilang i-weather itong COVID-19 storm. On the other hand, some have just the one oar. Ibig sabihin, nasa maliit lang sila na bangka at maari po silang maiwanan. So ganyan yung picture ng inequality that could be exacerbated, poverty that could be exacerbated because of the pandemic mismanagement. And make no mistake, I call it pandemic mismanagement because many other countries have been able to mitigate this risk of poverty and inequality already because their economies have already been able to open up, their schools have been able to open up. Why? Because of better pandemic response, better governance, and better leadership. So here, again, I pointed out earlier that inequality is a threat to our security as a nation. These are just studies that emphasize that the higher the inequality in terms of international evidence, the higher the violent crime in a country. So if we were against crime, inequality actually exacerbates the likelihood of higher violent crime. Inequality is also very much associated with higher terrorism risks. So if we are against terrorism, if we want to lower that risk, inequality is one of those variables that actually makes it worse. And if you think about it, pag-isipan po natin, ano ba yung inequality? Ang inequality po ay itong mga hindi pagkapare-pareho ng ating sitwasyon. At yung hindi pagkapare-pareho ay hindi dahil sa kasalanan ng ating mga kababayan, kundi kasalanan ng mga namumuno, kasalanan ng sistema na hindi pare-parehas. That is what will create resentment. That is what will create the seeds of rebellion, if you want to take it that far. So here is a quote I just want to read to you. This is a quote of a UN official. By and large, the destitute do not revolt. Ang mahirap ay hindi nagre-revolusyon. It is those who see a seemingly unbridgeable gap between their education and their aspirations, and the insufficient opportunities for advancement offered by an unequal society who take the path of violence. It's actually the non-poor that sees the big inequality. Sila ang nagagalit at sila ang they are the ones that take the path of violence. In turn, it is the combination of inequality and poverty that makes violence a mass phenomenon. So this is something to think about in terms of our need to contain this pandemic and also to resuscitate our economy as soon as we can. Now, before I begin to end, I just want to share a few international good practices, the lessons that we so far have learned, and the practices that we aspire to in order to have a better pandemic management response. The first is Taiwan, and I'm not going to belabor this point. Their strength is 100% health insurance. So nabanggit ko po earlier, pagka ang ating kababayan ay mas takot pa sa gasto sa ospital kaysa sa COVID-19, itatago nila yung symptoms. Hindi sila mag-health sick at the risk of COVID-19 spreading will be very, very high. And that is, of course, mitigated if you have a health insurance system that is very strong and also very inclusive. So we need to fix PhilHealth. And clearly, PhilHealth is one of those institutions right now that really needs fixing, really needs better governance and anti-corruption. In Thailand, there is a strong track record of public-private partnerships. We should not demonize the private sector. In fact, we should partner with the private sector because it is important for them to respond to the pandemic as well. Yan naman po ang nakikita natin na good pattern in terms of the pandemic response in the past few months. The private sector in the Philippines has responded very, very aggressively and very positively by undertaking some of the vaccinations and chipping in on the costs and contributing to the feeding programs in collaboration with other actors such as civil society, church, academe, and communities. So this is part of the good news that much of our private sector has actually taken a big, big role in responding to the pandemic. And this is really one of the lessons that we can even take from other countries. In Vietnam, it's transparency and trust. So less fake news, more truth. And the public sector is following clear and transparent protocols that build trust by the people. So pag nag-share ka ng information, poprotektahan naman yung information na yon, at there is a long-standing track record of trust in how the public sector manages that information and protects citizens. And finally, what many see as the gold standard of the pandemic management response, South Korea, they have a very, very strong test, trace, and treat strategy that was built even before COVID-19 struck. In fact, they learned the lessons from SARS, which is another disease that struck the world many years back. And they set up the system built into their healthcare system so that they are able to arrange that system and protect their citizens in case of a pandemic risk. At yun na nga yung test, trace, treat, and quarantine containment system that is so important right now, particularly because even vaccines do not have 100% protection of nations and peoples. Why? Because of the new variants that may be coming up. So the main lesson, it seems, from the medical and scientific information we are getting from across the world is that we really need a containment strategy that does not force us into lockdown, that has strong test, trace, and treat systems built in, high frequency and timely data that you can base your policy actions on, and that will allow you to minimize the economic and human development costs of containing this disease. So I want to end with this message for the officers and the men and women of the Philippine Navy. Again, I want to thank you all for the chance to speak to you today. If I were to end my lecture, I would end with these messages. First, good governance is a crucial ingredient of social cohesion, yung pagkakaisa natin bilang isang bayan. And fear and repression never lasts and always invites conflict and division. So between bakal na kamay versus kailangan i-build mo yung trust ng mga kababayan natin, yung trust, yan ang nakikita natin sa ibang bansa na mas malakas. At yan ang nagreresulta ng stronger social cohesion, mas malakas na pagkakaisa against the pandemic or responding to the pandemic. So social cohesion is necessary to overcome our nation's recurrent challenges, which includes but is not only circumscribed to the pandemic. Good governance also underpins strong economic management. So yung ating ekonomiya, it relies in the longer run on absence of corruption, but also good, strong public services, evidence-based policy making. So institutions for continued economic growth are necessary, and this is undermined by corruption. This is undermined by bad, public administration. So economic growth also drives our military modernization, and so therefore it links to your concern as an organization, to the concerns of the Philippine Navy. If our economy is not able to recover, then most likely it will pose a risk on our modernization and our capability building efforts in the armed forces. And so it is imperative for us to continue the growth and development of our economy so that our armed forces actually will move in lockstep in terms of its modernization of the economy, modernization of the armed forces. Finally, good governance is not just the absence of corruption. I noted this earlier. It is the presence of strong and stable institutions, the continuity of reform policies, and the integrity and innovation in public service. It's all those good things that make the public sector much, much more competitive, much, much more responsive to emerging challenges, and its ability to learn lessons well, such as the South Korean case where they learned their lessons from SARS, and so therefore they are now prepared for COVID-19. Tayo din, we have been at this for over a year and a half now. Mukhang hindi natin nalalearn yung lesson from the malfunction. At pangitan-pangitan naman doon sa listahang pinakita ko kanina, mabagal yung vaccination, hindi malakas yung test, trace, and treat, merong vaccine hesitancy challenges, and so on and so forth, kulang yung ayuda. So these are the areas that we really need to learn quickly, that we need to recalibrate and improve our response. All of this builds trust in the public sector. And I will end with the message that corruption is the real destabilizer Corruption erodes trust and diminishes our ability for collective action as a nation. I will end here, and I want to thank again Vice Admiral Bordado for the kind invitation, and I welcome our discussion in the question and answer portion. Thank you very much.